Assalamualaikum. Good morning to our lecturer Dr. Mazani bin Muhammad Yusuf and everyone. Today, I will presenting my research on the effect of on-call responsibilities on assistant medical officer, mental health and job certification in public health hospital prediction. This study aims to explore the hidden mental health challenge faced by MOs, especially in resources-limited public hospital. Healthcare workers often operate under constant high pressure. For MOs, this means balancing daily patient care with urgent, unpredictable on-call duties. This pressure can lead to burnout, low morale, and even emotional detachment. For example, a study showed that 17.5% experienced burnout, 38.6% had anxiety, and 18.7% showed symptoms of depression. In this research, I focus specifically on MOs in public health hospital, a group often overlooked in previous studies. MOs in a public health hospital deliver care in underserved areas and handle both regular and on-call duties. This unpredictable shift often leads to stress, anxiety, and sleep issues, as noted as by Franco. Despite their vital role, research and MOs limited. They face long hours, resources shortage, and minimal support system. This study used a quantitative approach to examine how these factors affect their mental health and job satisfaction. The main problem is the MOs face chronic stress from handling emergencies alongside regular duties. This unpredictability combined with limited manpower and resources worsen emotional fatigue and lower job satisfaction. High pressure environment without proper support lead to anxiety, insomnia, and eventually burnout. Coping strategies and urgently need to improve their well-being. The aim of this study is to evaluate the impact of on-call responsibilities and MOs, mental health, and job satisfaction. The objectives are: number one, to assess level of stress, anxiety, and mental health issues related to on-call duties. Number two, they examine the relationship between on-call duties and job satisfaction. Number three, to identify potential interventions to improve well-being in this group. Okay, now, literature view number one, on-call responsibilities and mental health. Elevated stress level on-call healthcare workers face heightened stress due to constant readiness and high-stake decision-making, sleep disruptions, and anxiety. Continuous mental alertness lead to sleep disturb and chronic anxiety. This is by Leslie 2023. And work-life imbalance being perpetually on call disrupt personal time, causing dissatisfactions in both work and home life, increased risk of a burnout, long hour, and unpredictable emergency contribute to emotional exhaustions and burnout. Mental health decline on call schedules links to high rate of depressions and anxiety among healthcare staff. This is by Al-Marzuki 2024. Okay, my literature review number two, on-call responsibility and job satisfaction lower satisfaction in the public hospital on-call duties are linked to reduce job satisfaction, especially in the public health setting with limited resources. Rural healthcare struggles. MOs in rural area report significantly lower satisfaction due to poor infrastructure and lack of support. Okay, this is by Zhang 2020. Okay, extended hour and constant availability, long shift, and the expectation to be always available contribute to emotional fatigue and dissatisfactions. This is by Hyponymy 2014. Okay, lack of support network, absence of organization, and emotional support worsens self-esteem and job satisfaction among healthcare workers overwhelmed by responsibilities. When MOs feel ill-equipped to handle their duties, their sense of fulfillment drops sharply. Okay, my literature review number 3, coping mechanism and strategy effective stress management technique. Okay, MOs use self-talk relaxation method and time management to reduce stress. This is by Orellana 2018. Okay, then mindfulness and deep breathing, regular practice of mindfulness and breathing exercise improve mental well-being and lower anxiety. Positive reframing through self-talk reinterpreting challenge with optimistic self-talk help most stay resilience during demanding on-call shift. Okay, gap in a public health research, most studies focus on hospital-based professionals overlooking AMOS in a resource-limited public hospital. Need for targeted solution, more research is needed to develop specific coping strategies for MOs in a public health setting. This is by Phoebe Jeans 2025. This is quantitative study focusing on MOs at the public health hospital policy. I use purposive sampling to target those with on-call duties resulting in 28 participants. Okay, my sample size is target group assistant medical officer or MOs with on-call duties in the public health hospital at Podixon. And my clinic selection is suburbans and my sample size calculation is 20x MOs. This is a sample calculator that I use. This questionnaire had a 4-section: demographic, mental health assessment, job satisfaction index, and a 5-point response scale. Data collection was done online by Google Form, ensuring anonymous and voluntary participation. So this is my Google Form for participant. The data was analyzed using SPSS descriptive statistics such as mean, standard deviation, and frequency were used to profile participant inferential statistics include presence, correlation to exam relationship between workload and mental health, and multiple regression to identify the most significant stress factor. This approach helped point exactly where this should be targeted. Expected significant contribution to new knowledge. Number 1, focus on MO's mental health. This research places spotlight on the often overlooked mental health and emotional well-being of assistant medical officer or MOs working in a public hospital. While much attention is given to doctors and nurses, MOs form a vital part of the healthcare team and frequently face intense work pressures. By addressing this gap, the study added fresh insight into the specific stressors and emotional burdens MO encounter, especially in the context of their demanding roles. Number 2, impact of on-call duties. The study explores in detail how on-call responsibilities which require MOs to be available at regular hours affect the overall job satisfaction, stress level, and psychological well-being. It examines issues such as sleep disruptions, work-life imbalance, and emotional fatigue. This in-depth understanding will help identify exactly how this on-call shift contribute to burnout and other mental health challenge. Okay, and then number 3, policy and support recommendations. One of the most important outcomes of this study will be practical recommendations for hospital administrator and a policymaker. This suggestion aims to improve the mental health support system available to MOs and change their job satisfaction. This could include structured counseling service, a flexible shift rotation, wellness program, or a peer support network. By presenting evidence-based solution, and the research aim to influence a decision maker to take constructive action. In summary, MOs plays a critical role in the public healthcare but face high stress from on-call responsibilities. By understanding this challenge and implementing target intervention, we can protect their mental health and enhance their job satisfaction. Thank you for your attention.